Hey all, I'm Pablo Curlander, PhD, Master and Doctorate in Public Health. I'm from Brazil, and I will present you a chapter of this Springer handbook of Addiction called Improving Quality of Life in Recovery-Oriented Treatment for Substance Use Disorders in Therapeutic Communities in Brazil. We will begin with a brief story of the psychiatry reform with these two main characters, Dr. Maxwell Jones of the UK and Dr. Franco Basaglia from Italy. The psychiatry reform started in the 50s and it aimed at a more human and comprehensive approach for mental disorders. The therapeutic community is in the origin of this movement. What we can see is that Franco Basaglia tried to develop a TC, Maxwell Jones TC method in Gorizia and in Italy. And after that, Franco Basaglia came to Brazil to know and to work with the people of the psychiatry reform movement from Brazil. Here we can see a picture of the Barbacena Psychiatric Hospital where Basaglia was in the 90s, and he compared it with a Nazi concentration camp. The, Soon after the movement began in Brazil, the psychiatric reform movement in the 90s, several psychiatric hospitals had their beds reduced and went even closed. This specific psychiatric hospital, the Barbacena, there more than 60,000 people died with suffer every kind of violence and abuse. So it needs to be closed for sure. But the problem is that in a decade, approximately 70,000 beds in the psychiatric hospitals were reduced in all the psychiatric hospitals in Brazil. However, they weren't created enough other services, different than what Basaglia did in Italy. He at the beginning create all the extra hospital mental health care network, and after that he referred the psychiatric hospital patients to this after extra hospital network. But here in Brazil, they did in this way. So what happened in Brazil was that these psychiatrist beds that which were reduced about 70,000, as I said, they moved to the disease beds. So in the same period, from 90 to 2000, about 70,000 beds in disease were increased. This it not means that the same people of the psychiatric hospital went to the disease, but it's really interesting that it's the same number. So maybe the not having all this extra hospital mental health care network uh, did that the bed synthesis increased. The problem was that here in Brazil, most of these devices, these places, which were self-called TCs, were absolutely religious-based programs and not necessarily technical programs that than the disease of Mabel Jones and Franco Basaglia. Uh, in this, regarding this, we have a historical process in the disease in Brazil that they began, as I said, in a religious period in the 60s and 70s. Many different religious movements started to take care of people who have mental disease and drug abuse problems, but there were only religious-based programs. After that, in the late 70s, Father Haroldo takes to Brazil the DATOP model, the more well-known technical TC model at that time. And in the 90s, when the beds in psychiatric hospital were started to be reduced and the beds in TC started to increase, as I show you, Father Haroldo created the Brazilian Federation of Therapeutic Communities, the FEBRAC, and launch after that the first code of ethics for therapeutic communities, trying to uh, regulate and improve technically the programs of the disease. But most of the disease continues until today, working in the religious base. And after that, after the 2000, uh, started the political period, and it was when the disease started to be funded by public, by the federal government and state governments. It was good on one hand, but on the other hand, the lack of regulation, the lack of technical and specific criteria to fund and to regulate and to monitor made that many movements related to the psychiatry reform started to position themselves against the therapeutic communities here in Brazil. To see something that really work here, I will show you the data of the Recomeço program, a program of the state government of São Paulo, Brazil, a disease funding program that is working until today. And I participate, regulating and monitoring all this process with the federal government and with several actors I will show you. I will show you data from 2014 to 2016 related to more than 8,000 patients from 48 diseases at this period. The funding program was carried at the beginning in São Paulo, Brazil. There was a program which reached 70 diseases and 1,500 beds. The Social Development Secretary of São Paulo was the responsible for the budget. The State Drug Policy Coordinator was the responsible for the process, and the Brazilian Federation of Therapeutic Communities was the co-manager NGO responsible for selection, supervision, monitoring, and payment. We developed at that time an online monitoring system to optimize the technical and financial report process, because this was a really important issue to show transparency, to show the reliability of all the program, and the TCs need to input data all the time in this program. The online monitoring system data inputted was at admission, the social demographic data of the inpatients, general mental health data, and evaluation of the motivational stage. Monthly, the staff needs to input the performed activities, the general and mental health data too, like that admission, healthcare network referral too, because they need to work with the healthcare network, and the social integration activities. At the release, the staff needs to input the objectives achieved, quality of life indicators, and psychometric scales were used for anxiety, depression, and motivation. And after that, the staff needs to carry out a 12-month follow-up after treatment for sure, with quality of life indicators, substance abuse indicators, and this follow-up was performed by phone calls to the patient and to the family. The Brazilian Federation supervise and monitor the disease with monthly technical visit to all the 70 diseases. Monthly technical and financial reports were sent, of the disease sent to the Federation, a biannual patient satisfaction survey, an annual TC satisfaction survey with all the program and the Federation, and quarterly TC capacitation to improve technically and ethically the quality of the staff, and so the quality of the programs, for sure. We reach these outcomes of quality of life and social reintegration outcomes of these people. More than half have a place to live at the release, considering that more than 80% were homeless before joining the TC. Many of them have been homeless for more than 5 years. And it's important to highlight that this number is for all the releases, not only for the people who complete treatment. A quarter have money to self-support, and considering that more than 90% of them uh, didn't have self-support are unemployed before joining DC, and more than 20% have both at the release. And for finishing, I will show you some predictive variables of better outcomes of housing and self-support we find, and there is all this data and extra data more than this shown in the chapter of the book that it will be released at the until the end of the year. I encourage you to read the chapter when it will be released if you are interested in having more data. The first of all was the more time in treatment means better outcomes. This is a variable ever related to better outcome for sure. But another interesting data is the 90 days in treatment. For the people who stays at least 90 days in treatment had 9 times better outcomes of housing and self-support, considering the people who stayed less than 90 days. And another factor we studied was the more developed activities means 8 times better outcomes of housing and self-support. So it was really important. The inpatients develop many kinds of activities. These activities are described in the chapter if you want to know more about this. So this is the presentation, this is the data, here is my contact. If you want further information, as if you want to receive the link for the chapter in the Springer Handbook when we release, okay, we will reach out to me. Thank you very much. And I hope that it will be interesting for you in your event during Greece.